This girl's heart is almost completely out of the body. This is a case of ectopic cordis, that is, external heart. It is a very rare case. The occurrence of the case is only 8 in about 1 million births. However, the reason we don't commonly see them around, or the reason because the majority of the children born with ectopic cordis die during birth in the first week of life or in the first month of life. Only very few among them live for months and years. So the question is, what went wrong? How does it happen? Now, during embryogenesis, that is, the formation of fetus in the womb, the rib cages from the left and the right will not be able to fuse together and form a cage. And so, the organs that are in the chest has propensity to wanting to bulge out of the chest. This is commonly seen in chromosomal abnormality like Turner syndrome or like trisomy 18. The only treatment for this kind of case is a surgical management. That is, the patient will be taken to the theater and the anterior breast cage would be apposed together and the place closed together. There are other conditions that are associated with ectopic cordis. So when you see one, you must look out for the others. Number 1 is cranial clefts. That is, the anterior parts of the head is split open, not closing very well, as you see in this picture. Number 2 is cleft lips or cleft palate. That is, the anterior part of the mouth is split open, as you see in this picture. The third one that you will have to look out for is hypoplastic lung. That is, the lungs that do not develop properly. This is the reason majority of these children don't live for long before they die, when they are unable to breathe very well. And number 4 of the things you must look out for in an ectopic cordis babies is scoliosis. That is, a spine that looks like S. The spine that looks like S you see in this picture. Another thing you should be on the lookout for in children with ectopic cordis is hole in the diaphragm. Hole in the diaphragm. That is, hernia of the diaphragm. The diaphragm is the membrane that separates the thoracic cavity and the abdominal cavity. It separates the organs in the chest from the organs in the abdomen or in the tummy. But when there is hole in that diaphragm, organs in the chest can be herniated into the abdominal cavity, or organs in the abdominal cavity can form an hernia in the chest cavity, depending on which pressure is much. Ectopic cordis can be diagnosed in utero, that is, when the baby was still a fetus in the womb, through obstetric ultrasound scan, either in the first trimester, in the second trimester, or in the third trimester. And once it is detected, it is very important that the woman does not go into labor to wanting to deliver the child by herself. It must be through cesarean section to save the baby and to save the mother. This is another reason why it is important for pregnant women, the moment they know they are pregnant, they should go to the hospital to register for antenatal clinic. Hi, I'm Dr. Onyida, and this is Flooded Medicine. If you want to see me again, like this video, share it, and follow my page. Thank you. I'll see you in the next video. Bye.